Hi, my name is Jason Ketchum from PatientIQ. I am based in Chicago, Illinois, and I am here to talk about all things patient-reported outcomes with a few folks who I'm going to allow to introduce themselves right now. Blake, do you want to do a quick introduction for yourself?
Sure, happy to. Thanks. Hi, Blake McWilliams with Patient IQ. I'm an account executive. I cover the West. Been in patient reported outcomes for about 10 years and devout data nerd.
Sid, do you want to say a quick hello and who you are?
Absolutely. I'm Sid Lockard. I am a quality executive at a large academic medical center here in the West Coast. I'm happy to chat about patient-reported outcomes and what they mean for us and the future of healthcare. Really excited.
Hey, Sid, in your role, what would you say are the three biggest challenges that you face as a health system executive on a quality team? There's a lot
Yeah.
of folks out there trying to figure out how that role connects to patients and the ultimate outcomes that they're getting.
Absolutely. I mean, I think the really exciting thing about quality in general and why I got into this work is because it allows the people in the quality department to sort of take a step back lens and say, how do we make our health system, our hospital, where we touch patients, how do we make that the safest, most effective place for these people to get care? I like to think of a concept that was introduced to me by actually a consultant, which is you think about your picture person, right? So this is who's on your phone background. If you're introducing yourself, oh, this is my son on my phone, how would you want them to receive care if they, God forbid, ever had to enter a health system? And so I think quality allows us a really unique place to be able to influence that care from a spectrum, right? As a part of an academic medical center, we have the continuum of care from outpatient through inpatient. We have hospice services, so we really see the gamut of patients from coming in from routine well visits all the way through the sickest of the sick. And so finding really meaningful ways to take data and meet sort of our service line providers, our frontline staff where they're at, because what is going to matter to a trauma surgeon is going to be very different than what matters to a family medicine provider. And so the lens of quality really allows us to drill down and say, okay, what matters the most to these people? And really thinking about our stakeholders and what we're presenting to them in the lens of quality. That being said, that also represents a challenge, right? Because I've not practiced in some of these arenas. And
Sure.
so it can be difficult to know what is the thing to focus on in any particular service line or for any particular procedure or patient type. And so I think the biggest thing for a quality executive is to be able to say, I know what I know, but I also don't know what I don't know, but I know who to ask. And sort of putting that ego aside and recognizing when I need to get a subject matter expert in. And that's sort of, I think, our job in quality is like connecting those dots and creating a place where we can all come together and really be collaborative in a way that we create quality across the system.
Love that. Blake, anything you want to kind of add on top of that?
Oh, I think Sydney nailed it.
That was yeah, Sid, no, I think that's really well stated. And I think that's kind of a piece that seems to come up more and more with almost everybody that I think we talk to. I think what a lot of folks are curious about is how different roles within academic medical centers or health systems view patient-reported outcomes. So as a quality executive, from your standpoint and through your lens, how do you view the use of patient-reported outcomes and what you can do with it?
Yeah, so I think patient-reported outcomes are actually a really exciting opportunity for us to, really healthcare in general and quality. We should all be coming at this from a place of data. And historically speaking, in medicine, we've been really great at collecting data. We have surgical site infection rates, we have readmission rates. Those are really hard numbers, right? Like it happens, it doesn't, it's black, it's white. And I think patient-reported outcomes is just a natural evolution of that, because at the end of the day, what we really are wanting to do is improve the lives of the people that we're touching, right? We can do a knee replacement, but if it doesn't make them have a better quality of life at the end of the day, then what are we doing here? And so to be able to incorporate patient-reported outcomes allows us to take, I don't want to call it subjective data because it's not, it's very real data from a patient, but it's their perception, right? It's their lived reality, and quantify it and make it actionable, right? It's a lot easier to go to a surgeon who operates in black and white and data and numbers and say, hey, when we do this, when this is changed in our quality of care, we're using this implant, or we improve our access to physical therapy, your patients have better outcomes. And it makes it a lot more tangible for them to implement into their daily practice. And I think it's just been a missing piece of our continuum of healthcare. Up until this point, we obviously have subjective, visit level data. Our patients are going to their providers post-op and having these discussions, but really having a collection of data makes it so that we can generalize it a little bit better and identify themes and trends that allow us to implement best practice across the organization.
Wow, that is you've got a lot baked into that cookie. I'm excited to see that play out.
I do have a follow-up question on that, just to kind of carry that thought a little farther forward. So, Sydney, how do you envision, you mentioned things like complication rates and reoperations and readmissions and some of the things that can be very detrimental to patients and their families, and also, have certain impacts on the hospital and the network itself in multiple ways. How do you envision influencing surgeons to view or analyze or utilize patient-reported outcomes data, and in combination with what other data, to get ahead of it, to sort of like quote unquote get it right the first time, not to imply that anybody's getting it wrong, but to reduce those costly events?
Sure. I think it's kind of a big answer,
Uh,
but a lot of times in medicine, right? Like, and I myself practice bedside nursing, so I do come at it from a slightly clinical lens where we are trained in a certain way, we learn things a certain way, and unless we have that continued sort of visibility to what's happening, it can be really easy to say like, well, that's just how I've always done it.
mhm.
There's no business medicine. If you ask me that, like if you answer that question for me, I'm gonna push back, because I obviously haven't been, not obviously, but I haven't been practicing super long, and things are still different than when I graduated, right? And so I think the ability to give them a current state. So, for example, at my academic medical center, we have a lot of clinical pathways, particularly in our orthopedic service lines. We have several.
Mhm.
We've had a call for data, right? We sit down with our providers and we say, hey, this is how your patient population is functioning. I'm going to use hip and knee because that's my personal favorite clinical pathway. It's the very first one we created.
Sure.
It's also very tangible, right? Like hips and knees tend to be, what a knee replacement is, even if you're Mr. Smith on the street.
Right.
And so to be able to take to them with this additional piece of data of like, okay, we have information about your length of stay, your reinfection rate, your readmission rate, but then also like folding in how patients are responding and making it, because I think in medicine, it can be a little bit easy to lose track of the fact that this is a human being with passions and desires, and they want to travel, they want to run after their grandkids, they want to insert activity here, and
Exactly.
sometimes when we're just looking at rates and we're looking at things like that, it can be a little bit easy to make that a homogenous population, and when
Mm,
in I think patient reported outcomes, it keeps it real at the personal level.
mm. That's awesome. That's
Yeah,
great.
that was well stated. All right, Sid. No, that's been great. Super helpful. Really appreciate it. One thing that a lot of people are really curious about is, at your level, from your position and through the lens that you use, how are you planning on taking patient-reported outcome data and using that to inform change at the service line level?
Yeah. So I think what's really important is, I think the first thing that comes to mind when you ask that question is the culture of a health system matters, right? And the focus of a health system really, really matters. When a patient shows up, they should get an experience that is in line with your organization's values and your mission and your vision and why you show up to work every day. And we obviously have lived in a world where, patients get experience scores and things of that nature. And I think patient reported outcomes make it a little bit more data driven, right? Like it's more specific and focused on the specific questions that we're asking in those patient reported outcome questionnaires and things of that nature. And so from our perspective, it really is, from a quality lens, going to allow us to take a look at across the continuum, provider to provider, creating this consistency, right? That when you show up to my hospital, we are aiming that you have an experience that is in line with what we want you to experience, regardless of what location you go to, regardless of what reason that you're here. And it provides us with a little bit more visibility and maybe some practice variation, or honestly, it's probably going to be more of, hey, we have this provider, or we have this particular disease process or whatever we're doing really great at this. How can we model this and how can we expand this? We love to use what we're doing really well and use it as templates across other organizations, other service lines, because I think that allows our patients to always feel at home when they seek care with us. I am very fortunate to work for a health system where I have a C-suite that supports this vision. It's messaged in every single huddle we have. It's messaged in every single directive that we have. And so really the goal is to have the patient be the center of the experience. And so that is really enabling us as a quality department to be able to go in to different areas and see these patients, number one, as whole people. I think I alluded to that earlier, right? Like you are not just a knee, you are not just a hip. You are a person that maybe you struggle with depression, maybe struggle with pain outside of that. And we need to be able to see you holistically, and ensure that we're addressing all of the things that we're seeing in your patient reported outcomes, your surveys, your questionnaires, to, at the end of the day, have you have a positive, helpful and healthful experience.
Wow, that was really, really well stated. I was going to ask a follow-up question about how you think that can engage across the broader health system, but I think you probably already answered that, because you talked about the culture of the health system and putting the patient at the center of that, kind of on the pedestal, which I think resonates certainly with me, but with a lot of people. And it sounds like through your lens and through your organization's lens, that the patient reported outcomes can help ensure that patient stays central, and really informing across the entirety of the health system to ensure you're sort of fulfilling that mission that you laid out. Is that kind of accurate directionally?
No, I think it is accurate directionally. And I think the really important thing is that, especially when you become part of larger and larger and larger health systems, right, you have this propensity to, a patient might go to different locations. They might see this provider for that thing and that provider for this thing. And patient reported outcomes, really, I envision it as allowing us to keep track of, like, how are you doing, right? Like, I'm not just the person treating this condition that you're seeing me for, but I can zoom out a little bit and assess you as a holistic person. And so I think baking that into how we care for our patients, I think we're going to see our patients be happier. I think we're going to see better outcomes overall, right? I know I touched on like a depression screening earlier, and we know that patients who have uncontrolled depression, uncontrolled anxiety, they do worse coming into and out of surgery. They have less effective pain control. And so taking a beat, right? And it always can be a little bit difficult in medicine to say, hey, let's take a second, right? Because we're focused on, a lot of times, volume, right? We're focused on volume, we're focused on efficiency, we're focused on throughput. But really, at the end of the day, when we take the time to just breathe for a second and make sure we're addressing everything that the patient is concerned about or the patient needs, we're going to see the return on investment. We're going to see the financial implications of that down the line. And so I think patient reported outcomes really provide us an avenue to have, going back to the data piece of it, right? And at the end of the day, we're all beholden to producing results. And so I think the patient reported outcomes piece is really going to be important for us to have that data, to make it tangible and like prove the value of what we're doing here.
Kind of sounds like what you're saying is an investment in patient reported outcomes is an investment in the long-term viability of patient centricity in healthcare.
100%.
That's kind of what I'm hearing.
Yeah, I mean, in my view, and from what I know and from what we've seen implementing these in other ways, when we can really view the patient and take that into account, right? Like healthcare is a business, and we want return customers, right? We want patients to want to come to us again when maybe something completely unrelated, but they know, hey, they took the time to take care of me as a patient, and I can see that in how they accessed my, what surveys I asked. It wasn't redundant. And that was incorporated into my care. It wasn't filling out paperwork for paperwork's sake. It really, I think, can go a long way in making our patients choose us again.
Sydney, thank you so much for
Awesome.
the time. Blake, is there anything that you want to add in before we let Sydney go? She's been so gracious with her time so far.
Just echo your gratitude. Thank you, Sydney.
Of course. Hey.
Awesome, Sid. Take care.
Bye.